All right, guys, this is treatment 3. We're here with, again, our patient Eric, giving us a glimpse of what a treatment is in therapy. So we're just going to recap real quick how his shoulder's doing. So how do you feel? How's your shoulder?
It's better. It's not clicking as often as it used to.
Okay. Are you back to lifting?
Not 100%, but I'm starting.
Okay, gotcha. So there are a couple of things that, if we recap, he had some shoulder pain. He had a lot of instability, which he's going to define as clicking and clunking every time he moves the shoulder. As far as objectively, what we did was test him to see his how strong his rotator cuff is. So we're going to check it out right now. Go ahead and thumbs up. Bring it to the side a little bit. All right, hold it. Don't let me push down. Good. So stronger. Hold it. Don't let me push down. Ready? Now drop that. Good. Hold it. Good. So you guys can see he's a lot stronger. It's only been 3 visits, and if we talked about it at the assessment, we weren't worried that he had a muscle tear or a strain, that he really just had a kind of a dysfunction where the joints were off, this muscle was working too hard, as you kind of saw that real prep. So real quick, what we're going to do also is to kind of give you guys another option or view. We're dealing with an athlete, we're dealing with a patient who doesn't have time for himself. He's very busy working and all the other family stuff that's going on. So we want results, and we know that this patient can't come 3 times a week and all those other good stuff that used to happen. So what this is, we're gonna introduce it to him. They're called Graston. We're doing Graston for him because we are trying to break up scar tissue using tools. So think of it like a deep tissue with tools. Same concept, we're trying to break up these adhesions, all this taut tissue, so his shoulder can move again. And that way, again, we don't have a tear or a strain, but we do have a lot of dysfunction of the joint. So we're gonna do the Graston technique real quick. Don't worry about the tools, they're just contoured for his body, but I will give you a little glimpse of it. So we were showing you in a really quick way muscle testing, but we're gonna show you other weaknesses that he has. So go ahead and hold your thumb up. Don't let me push down. Okay, so again, hold it again. All right, and same thing, I'm gonna just drop your upper trap, hold it. All right, so again, we're just showing you some muscle weaknesses. We're gonna grasp in a little bit and then see what the difference is. So we just did a couple of strokes, and we wanna kind of just quickly retest, so go ahead and hold your arm up. Good, don't let me push down. Okay, hopefully you guys can see that I am not messing around, that you know, just from breaking up some of those adhesions, his muscles and his joints were able to talk. He wasn't weak, it was just more of a dysfunction like we talked about. Thumbs down, he knows. And again, hope you see I'm really trying. All right, so I hope it didn't hurt you. But that's the difference, and that's how quick a result can happen. Again, every patient is different. This is not the tool that I would use for everyone, but in his case, someone who doesn't have the time, has some old stuff going on, we just want to get right into it. So if you guys remember, we were doing soft tissue stuff with my hands while he was on his stomach. I do want to accomplish the same thing. I want to see that shoulder blade lift off his back a little bit better, but we're going to still do the same with the Graston. So we can accomplish this many ways. Again, soft to deep tissue with our hands, but the tool is going to give a quicker improvement. You can also see that reddening that we saw before. It's happening less, but there's still some of it there. Again, that's called petechiae. That's indicative of scar tissue or some adhesions that we're breaking up.
My session today was actually interesting. It was different. Got to see this new technique where never seen before, Graston technique. It seems to have some really good, it looks painful, it feels a little weird, but it leaves a mark, but absolutely I feel different. Like I actually see I feel heat. I feel like the warming up of the area that it was treated. So it's definitely different, and definitely feel some vast improvement in terms of strength. I see that after each treatment, there's areas where I was weak. It has definitely improved. So I'm looking forward to continuing.